Hello, my name is Melisa Shilisia. I am a psychologist by profession and at PCEA Chogoria Hospital. Today we are here to talk about mental health. So mental health is the wellness of our being physically, mentally, socially and spiritually. When a person is performing at a satisfactory level, we usually say that these four aspects are working well and they are able to be sociable, their spiritual life is at par, and physically and emotionally they are well. So parts of a human being that get affected when it comes to mental health is their thinking, their perception, their signaling, their physical and their behavior, together with their emotional being. So when I expound on probably the emotional part, a person's emotions could change when they are mentally ill, and the common disorders that do affect the mood are like depression and anxiety. Looking at signaling disorders, they are such as panic disorders. This is when the body signals that the brain that there is danger around you, when in actual sense there is none. So the body gets to react as if there is danger, but in actual sense there is no danger. With behavioral disorders, we have an example of attention deficit and hyperactive disorder. So attention deficit is often diagnosed in childhood. However, we have adults who have been undiagnosed. Such a condition occurs when a person experiences low concentration levels, and at the same time they are quite hyperactive and they feel like they need to do a lot of activities all at the same time, and they are unable to prioritize the activities they need to do. With with perception disorders, so perception is how the eyes and the other senses of the body communicate with the brain about your environment. With perception disorders, what happens is this communication is usually interrupted, and a person is likely to experience things we call hallucinations. This is where they see or hear things that do not exist, or other people cannot see or hear, or they feel on their skin or under their skin things that cannot be seen or explained. So these are the how we group the disorders and how they affect a person's being. Some common disorders that we experience even in our community are depression, anxiety, psychosis, substance use disorders, and traumas. We experience all those in our communities. However, this is not a limiting factor when we look at disorders. Disorders are a wide range, and it is important for someone to understand their natural self, and in case they feel like they are not themselves, or you feel like your brother, your sister, or your neighbor are not being themselves, they can come to the hospital and be checked for any condition or any mental health disorder. So there are different factors that affect a person's mental well-being, and the primary one is often genetics. So genetics is are passed on from a person to their children, and there are certain disorders that when they occur, a person can pass them on to their kids, such as substance use disorder, or even psychosis can be passed on from a parent to a child. So these disorders often don't come up until a certain age in life, or until there are other triggers such as loss of a loved one, or an environment that is harsh or unconducive for a person, family instabilities such as gender-based violence, or an environment at home that is not calm for a person. Other predisposing factors are such as chronic illnesses. Chronic illnesses, a good example is hypertension, diabetes, and cancer. Such illnesses take a long time to be treated or managed, and as a result, a person can experience strain in the period that they are treating or managing this condition, and this can cause a mental health problem to the person. the most common ones we've seen is depression and anxiety in such patients. And some of the warning signs of a person who has mental illness is when they are experiencing change in their eating habits, change in their sleep patterns, poor hygiene, when a person who would talk normally in a calm way suddenly starts talking too much or with agitation, someone who's experiencing suicidal thoughts, difficulty in performing day-to-day tasks, or severe mood swings and isolation from others. These are just a few symptoms that can indicate a person could be mentally ill. It is important to keep in mind that all of us are predisposed to mental illnesses. Statistics state that 1 in every 4 people could be having a mental health issue. This shows that the numbers are great, and they are becoming even more as the years go by and things get difficult in the world we live in. So it is important to come in for checkups whenever you feel that you could be having a problem, and get help from a certified professional. May is Mental Health Awareness Month, and as we go through this month, we'd like to create more awareness. The theme for the month is community. Community plays a very great part in mental well-being of the people around, and it is important that as the community embraces mental illnesses and mental wellness, stigma on people suffering with mental health should be reduced, because they are ill like any other person who could be ill. Always remember, there is no health without mental health. We welcome you to our mental health clinic at PCEA Chogoria Hospital. We are open every Monday to Friday from 8 to 4 p.m. As you know, at PCEA Chogoria Hospital, we care with love.